Thank you for joining us today on Connect and Collaborate, where we come together each day to introduce you to our network of business and community leaders and to discuss important issues that impact business in Colorado and the region. I'm Tammy Schaefer, your on-air producer, and this week on Connect and Collaborate, we're taking a closer look at healthcare with some unique perspectives. And today we are connecting with Andrew Graham of Clinic Service. And Andrew, I want you to tell us this partnership you've brought together with David Silverstein with brokenhealthcare.org.
Sure. So thanks, Tammy. My business primarily is medical billing, and so I am on the inside of the medical industry on a regular basis, and what I see is when there is a patient charge or a patient visit and it turns into some sort of charge, what that charge is. It is no secret, no surprise to anybody in the universe that the healthcare world is a fairly convoluted place. We have a joke in my business that the more the government screws up healthcare, the more likely we are to have jobs. So far, so good is the punchline.
Good for you, right?
For that. Well, not necessarily.
I'm teasing.
Because even though we live in this convoluted world, it's not okay.
Exactly.
Everybody is 1 degree of separation from somebody who has some wild medical billing story. Exactly. I went to the hospital and all of a sudden I have an $80,000 bill sitting in front of me. A couple of years ago, 5 or 6 years ago, David and I came together initially as just friends and colleagues and two guys that run two separate businesses that like to share notes with each other. And in the process of that, David informed me of a medical story much along the line of what I just mentioned and what he was going to do about it. And he created an organization called brokenhealthcare.org that in essence helps people fight these ludicrous medical bills. So as this has progressed, it's certainly gained some traction that we'll get into here as we continue forward. But David, maybe if you could just tell us a little bit about your story and what brought us here today.
Sure. No, I appreciate that, Andrew. So, as you said, it was about 6 or 7 years ago when I saw that first bill for $12,000 for a very short, very mild emergency room visit for my daughter.
Oh.
And as I'm looking at it, I said to myself, well, this isn't so bad because there's another line here that says I actually only owe $980. It's terrific. It's not bad. I have a management consulting firm. We work with hospitals, insurance carriers, and I know emergency rooms are expensive.
Yeah.
So I asked myself, who pays the $12,000 though? And my daughter and I started digging into that, and the answer we got back was people out of network, the uninsured, and we started to look at the numbers, and I said, wow, this is unbelievable. My insurance carriers negotiated a 92% discount to the prices. What kind of an insane world is that? When I go to buy gas, I'm looking at whether it's $2.22 a gallon or $2.26. Right, I'm looking at a 2% difference.
Right.
When I want to lowball somebody on a $900,000 house, I might offer them $850. Right, what is that? 3-4% difference.
Yeah.
92. So some people pay $980. Some people pay $6,000. Some people pay $12,000 for the same thing. And so we created brokenhealthcare.org to start helping people that were getting hit with those $12,000 bills, with the $6,000 bills, for what clearly the fair market price is about $980 if that's what's been agreed to with the insurance carriers. But along the way, we started to learn all kinds of other things, and we really started to understand the whole picture of healthcare and just how crazy and dysfunctional the entire marketplace has become. So what Andrew and I have been talking about and working on lately is not just how we help all of those people out there who are getting creamed by the healthcare system, who are getting driven into bankruptcy, who can't provide for their family, but we're also really concerned about the American economy. We're concerned about businesses here in Colorado who are every single year seeing their health insurance costs and their health care costs in general go up at twice the rate of inflation. Because if you do the math, we implode in the next 10 to 20 years if things keep going down that road. And so what we're doing right now is we're driving the one thing that we've concluded through a lot of analysis can put the system back on track and turn healthcare back into a market-driven system, and that is complete and total price transparency on all sides of the healthcare equation.
We're definitely approaching it from a business approach.
Right.
We're looking at this, certainly all of us are consumers of healthcare. You're a consumer, I'm a
Yes.
consumer, David's a consumer. We have very little control over what it actually costs. And most people don't know what it costs. Most people don't care what it costs.
And you feel you just have to accept whatever they're going to.
And you feel helpless.
My
Right.
my family's health insurance is going up $300 this year, and we barely used it last year.
$300 a month.
$300 a month.
Right. I was going to say $300.
Is not
$300
bad.
a month.
Yeah, no, $300 a month is, but we're not even using the services. We have an HSA, a health savings
Yes.
account. This is my personal story. A health savings account that covers everything over the $10,000 threshold for a family for us. A couple years ago, we had we had two children where we carried health insurance and got no health insurance benefit because of the fact we carried health insurance, because we were responsible for that first $7,000 is apparently what it cost to have a baby.
Oh.
And so since we didn't hit that $10,000 threshold, my insurance was nowhere to be found in the story.
So you had to pay all of it.
100%
Wow.
cash pay by me. And I know that HSAs
It's like
represent
your deductible for bringing a child into the world.
it pretty much it's cost more ever since.
Wow.
Yeah, but we right now we're in a scenario that we buy health insurance, but we don't see the benefits of that health insurance. And I get how insurance markets work, and I understand that premise. So I'm not
Yes,
going to act like
you're
I'm naive
right.
to that, right? But 52% of the U.S. population is on some form of government health care, whether it be Medicare, Medicaid, Indian Health Service, government workers.
The VA.
The VA, over 50%, there is a guaranteed payer called the federal government that is paying for all of these services. That leaves a pool of less than 50% of us who have to cover our own costs.
Right.
You have corporations going to direct primary care. They're withdrawing from the market. You have corporations that are self-insuring because they can afford to do it. They're withdrawing from the market. So the pool of possible payers has been even further reduced. So now we're down to the pool of possible payers, the people who should care about their money. I like to think I care about the federal government's money.
Right.
I do, but that's a whole process I have to tackle to get to that. I care about my money.
Right.
I care about my money as an individual, and I care about my money as a business owner and the people that we support and want to make sure that they have adequate coverage from. They have no control. Absolutely no control.
Right.
They don't know where to walk into. They lack a lot of information. Most people think I pay my $20 copay, and then as soon as I pay my $20, I can get the cure for cancer as far as I'm concerned. What's the problem? Pay up here, right?
Not anymore, though, right?
No.
Not with high deductible plans, not with the copays going up. And more you'll get that letter back from your health insurance carrier saying, that's not a covered service, that's an experimental service, we don't support that service. And yet your ability to go and shop around is next to nothing. You know,
This week, I'm expecting our group health insurance rates. I know what my personal is. I'm expecting our company's group health insurance rates to come in. And once they come in, it's not a negotiation.
No,
It's not a conversation.
Right.
It's a, hey, sucker, here's what you're on the hook for this year. You're going to be nice to your people, or you're going to go out of business. What's your choice?
Yeah, yeah.
And that does not a market make.
no. And, you know, 7 days ago, January 1st, a new law went into effect, Senate Bill 65, that was passed in 2017.
1765.
That tells us that healthcare providers, think hospitals, doctors, have to tell us what the prices are for their 15 most commonly done procedures. I called 5 hospitals today and asked for that information. They laughed at me.
No idea.
They didn't know about the law. They said, sir, we have no idea how we'd figure out what our 15 most common procedures are. Sir, do you have a diagnosis from a doctor? What procedure are you looking for? And I said, well, I don't know what the top 15 procedures are that you do. Those are the ones I want the price for. Sir, we don't have that information.
It's going around in circles.
Right.
Just
So
to,
not only is the information not available for Andrew, for his employees to shop around for their services, to take some control, but we do such a poor job of legislating this that even the law isn't going to be followed because there is so much pressure on the legislature from the big lobbies that everything gets watered down. In fact, when you ask the sponsors of that bill what prices should be published, what does that mean, the prices? They can't tell you. They can't actually define what price means. And so there, as Andrew said, we as consumers, we as employers, we are in a helpless situation right now. And the result of this is that the system has become totally dysfunctional.
Well, and just as an example, I think that anybody can make, a couple years ago, I needed a procedure and I'm calling around, how much will it cost? And the answer is, it depends. And I'm like, well, that's the wrong answer. That's not acceptable.
Or
Right?
they tell you to check with your insurance carrier, right?
And then when you look at it, it's broken down into, okay, well, the doctor's going to be using this equipment. You've got the doctor's fees. You got the building fees. There's so many ways that it's added up that there's no way you can compare them from one facility to the next.
That's right. And in fact, in many cases, they won't give you an answer because your doctor hasn't scheduled the procedure there. So at the one facility where your doctor scheduled the procedure, they'll give you an estimate of the charges. But you can't compare that to other facilities because you haven't scheduled your procedure there. So the idea that you can even shop around is kind of nonsense. When you turn to your health insurance carrier, what they want to know is precisely what the diagnosis is, precisely which doctor you're going to go to, so you then can't shop around either, because they'll only answer you, they give you answers in your very specific.
Is that already worked out for that doctor then? Because then you're not comparing it to an overall.
It's one of the claimed benefits that an insurance company does for you. So what an insurance company's premise is a collection of people, members, pay money to an insurance company. That insurance company then manages a network of providers and hospitals where they have pre-negotiated agreements with them that you as a member get the member benefit by going to those facilities to get that. It's very basic insurance logic there. The problem is I'm responsible for a good portion of the payment now. And I have no connection with the agreement between the payer and the doctor. I'm told these are the hospitals I can go to, and if I stay in network, I get the benefit of those network benefits. If I go out of network,
perhaps 92%
I'm on my own.
Well, then, Andrew, remember what happens to you often, right? When you believe you're going somewhere in network, you get what's called a surprise bill from somebody out of network. So,
and hospitals don't police this.
No. Broken Healthcare has a patient right now that went for emergency care at Swedish Medical Center. A separate bill came from the trauma surgeons out of network. Swedish is network, the trauma surgeons out of network. I called the trauma surgeon, the physician practice, and I said, hey, can you tell me which insurance networks you're in? And they said to me, oh, well, sir, we're not in any insurance network. We're the trauma surgeons. I said, you're not in any insurance network. I said, well, then what happens? Because when my patient thinks they're coming to an in-network facility, well, sir, they can always appeal that with their insurance company.
Oh, that's fine.
And I said, so are you telling me that 100% of the patients that come to the emergency room at Swedish Medical Center should have to expect to appeal to their insurance company? And they said, well, sir, I misspoke. There's actually 2 doctors that do take some insurance. I said, can you tell me when they're on call? Can you tell me when they're going to be in the ER? Can you tell me which 2 those are? Well, no, sir, I don't have all of that information for you. I said, so let me see if I've got this right. I come to Swedish Medical Center, ER, because it's in my network. 100% of the time I'm going to get hit with an out-of-network charge, and I should have to appeal that to my insurance company because it's emergency care. And she said, well, yes, sir, I think that's essentially right.
Wow.
Because what happens with these emergency room physicians that are not employed by the hospital is they hide behind the veil of the hospital, right? The hospital does the marketing and sales for them. They bring patients through the door, and then you've got doctors, generally emergency room physicians, anesthesiologists, pathologists, radiologists. They have no incentive to be in an insurance plan, but they don't tell you that. All they like to tell you is, oh, I'm very sorry, I'm not in your plan. Only when you ask the hard questions do you learn that they're not actually in any plan because they have no incentive to be. These are the kinds of games that are played with people every day. They're given intentional misinformation, such as, well, we're not in your insurance plan versus we're not in any
insurance plan. People
then get hit with bills that are orders of magnitude higher than they should be because they don't have the negotiated rate with their customers. Andrew will tell you, I think, Andrew, the numbers you've given me in Colorado is that doctors generally are charging 150% to 250% of Medicare, hospitals as much as 3,000% of Medicare, which means if you're not in an insurance network and you don't have Medicare or Medicaid, you're getting hit with a bill that's 3,000 or 30 times what the fair price is for those services. There's no other marketplace in the world like that.
A good example, and David, I'll pick up on what you teed up. If I hurt my pinky, this little pinky finger right here, if I hurt this pinky finger and I wait a day and I go see my primary care doctor, it's going to cost about $85 in a doctor visit. The visit would be called a 99213.
Okay.
99213 is a standard office visit for any doctor. The same code is being used at an urgent care, is being used at a freestanding emergency room, is being used at a hospital emergency room, is being used at a hospital. 99213 is standard office visit for my little pinky.
Okay.
I have $10 worth of supplies to kind of fix my pinky up, maybe $20 worth of some miscellaneous other stuff. I'm out the door for maybe $115, $120. If I walk into an internal medicine doctor, that $85 just became $120. The $120 is because he has an increased reimbursement from a contractual provider, plus the same $10, plus the same $20. I'm out of there for $150. If I walk into an urgent care, the base price is $160. If I walk into an ER, the base price is $3,000.
Wow.
All of them are guilty at some level of not telling me what it's going to cost to fix my pinky.
And here's what happens when we get to transparency. When you have a truly transparent system, not a partially transparent system, not a system like Senate Bill 65 from 2017 that makes things sound like they're transparent, but a truly transparent system, when all of that is visible, a couple of things happen. One is people say, you know what, now that I understand that an emergency room costs 20 times what urgent care costs, I'm going to go to the urgent care. But what also happens is the emergency room says, or the hospital says, we don't want to lose that business. So we will now be competitive and we will figure out a system to triage people. And when they come in, we'll figure out, we might not be able to charge to treat them for $160, but we'll figure out how to do it for $200 or $250. And if it's more convenient and people want to come in and they know they're paying that premium, they can. But right now, you've got an awful lot of people. Everybody goes to the emergency room for the first time at some point. Many times it's a parent, 30, 35, 40 years old before your first child hits their first emergency room visit.
Right.
How is it that we can fairly expect people to understand how the healthcare system works? We don't teach them in a civics class in high school, right? We don't teach them in a finance class.
Information would be
that's right. And so
obsolete.
So transparency is going to completely change the nature of healthcare, and we've never had it anywhere in this country before. There's been lots and lots of nods to the concept of transparency. It's never been done in any real and comprehensive way, and that's what Andrew and I are going to make happen here in Colorado.
Yeah, how are you going to do that? How can you get everybody to cooperate and?
Well, that is a daunting job, but it's one we've been tackling here for a little bit now,
Yeah.
and we first of all we started this from a business perspective, not just as business owners, but how would you, if you were creating this system today, how would you create a system that allowed for the greatest efficiency, the greatest effectiveness, the greatest fairness within the price points there? We then had numerous conversations. First of all, we used our own intelligence and knowledge and background and experience. I'm in the medical billing business. We manage about 200 doctors' offices. I see charges fly around for all the different types of specialties on a regular basis. I've got a pretty darn good database on what actually happens in this marketplace. Couple that with being an industry professional in the healthcare business for about the past 18 years, I generally know what I'm talking about, or at least I'd like to think I know what I'm talking about. And
I can see that it's going to take people in your position to be able to sort it out.
We then, once we got to the concept of what was price transparency, why do we think people should know the basics of what things cost, we asked questions. And we asked questions of relevant people. And this is a curious and somewhat very important point, is there is not a hospital CFO in the country that would say, my hospital should be more effective in the way that it prices its services. Not one. All of them say, we need to maximize our profitability for our shareholders, whether they're a nonprofit or a for-profit.
Right.
Nothing wrong with Milton Friedman, but we need to go ahead and make sure that we are making as much money as we humanly possibly can. UC Health is a terrific example of a nonprofit hospital that's got $1 billion endowment taking over the world here. No CFO there.
That raises money, that accepts donations, and yet there was just a big article in the last few days on Modern Healthcare about how nonprofit hospitals are spending less than 1.5% of their revenue on charity care.
Charity care.
They're not giving anything back to the community anymore in exchange for their nonprofit status. It's all about maximizing profitability so we can build new wings. And you know what? You have to separate out the caregivers from the business practices, because the caregivers are there to do a good job.
Right.
And so
They took an oath.
So I don't want them to misunderstand that we think ill of the care of the providers, because you know what? They're helpless. They're not in the business of running the business. But the business practices, it's become all about profit, and some of the worst offenders are the non-profit hospitals. I actually got a letter back from one hospital. The signature of the person writing back to me, Revenue Enhancement Specialist.
Oh, wow.
Can you imagine? So that's the title.
From a nonprofit?
Yes, from a nonprofit.
Nice.
So that's the title that some CEO assigned to somebody in their hospital system here in Colorado, and they care that little that anybody even recognized what kind of message that sends to the patient, that we have Revenue Enhancement Specialists, and we put that on our letterhead.
So what we found in this research is no CFO in the world would speak up and say, no revenue enhancement specialist would stand up and say, this is wrong.
Right.
This is not patient-centered. This is not economically viable for everything that we're doing. See, every CFO that we talk to says, don't mention my name, but here's all the information you're looking for.
Wow.
Well, that's right. So I think the point is, most of them do say in private, yes, this needs to change.
Yes.
They won't say it in public.
They
because
can't.
Often
They
the
can't
business
possibly.
practices and demands of the business and what people personally believe, they diverge. And what we hear time and time again from hospital CFOs, CEOs is, look, the system does need to change. It's out of control. We can't change it from inside, because we can't play by a different set of rules than all of our competitors.
Right.
So what we're asking them all to do is to step up and do the right thing and not oppose the work Andrew and I are doing, both with the ballot initiative and working with members of the legislature to bring real price transparency to Colorado, and for Colorado to be an example for the rest of the country. They can oppose it, but it's going to be very clear to their patients and all the citizens of Colorado that that's being done for very selfish reasons. Or they can do the right thing and stay silent and understand that when things change, they will change for everybody. They will all change by the same. They will all play by the same set of rules, and it will be like every other business. This idea that healthcare is different is just utter nonsense.
Yeah, at the end of the day, maybe this is my opinion, but at the end of the day, you're responsible for your own health care.
Right.
You're responsible for taking care of yourself. You're responsible not for drinking all those sodas. You're responsible for avoiding the sugary snacks and avoiding the fat. And you share some of the responsibility for the cost of those services.
Right.
And so all of those factors have to come into play. If I'm going to accept that level of responsibility for my health care, for my life experiences and choices, then I also have to accept the responsibility for the costs of those. And if I'm going to accept the responsibility for the costs of those, I want to know what it costs. I want that to be open.
Absolutely.
I want that to be available. I want to see what my price is. Not that I understand there will be scenarios where I'll walk into a hospital or a doctor and crazy stuff just happened that when you add A plus B plus Z plus X together is going to come up to a healthcare bill. I get that. But if it's not managed like any other market we have that exists out there, there is no,
But you know what, Andrew?
there's
That's
nothing to stop them.
And that's not an excuse for obscene
Pricing. No.
Right.
That might be an excuse for a very big bill. But, when you walk into the supermarket and you just came from having a couple of glasses of wine and you haven't eaten since lunchtime, all of a sudden your shopping basket's full of a whole lot more things than you were expecting, right? And you're spending a lot more money, but the prices are still fair, market-driven prices. So we do have to separate out what the issues are here. And you're right, you might wind up with those huge bills but the prices need to be set fairly, transparently, and consistently.
Yeah, there's an adage of if you walk into a restaurant and they don't have prices on the menu, you should probably leave.
Yes.
That's kind of what's going on in hospitals right now, except
Absolutely.
you don't have a choice to leave the restaurant right now.
You are listening to Connect and Collaborate, the voice of the Colorado Business Roundtable. Today we're focusing on healthcare with Andrew Graham, President and CEO of Clinic Service, who has partnered with David Silverstein, founder of BrokenHealthcare.org. We're going to talk more about price transparency in the healthcare industry as we come back. Stay with us. We'll take a little bit more focus on the ballot and the bill and what they're going to do with the state legislature here in Colorado. Glad you're staying with us today here on Connect and Collaborate. This week we're taking a closer look at healthcare with some unique perspectives. We're talking with Andrew Graham of Clinic Service and David Silverstein with brokenhealthcare.org. This is an effort to really look at the transparency, get transparency from the healthcare industry.
We're trying to answer a very simple question. When you go to the doctor, shouldn't you know what your services may cost? Not will cost,
right?
May cost. That's it.
Yeah, so there could still be some fluctuation, but you at least have an idea.
Not what Andrew means by
okay, tell me.
What he means is when you go to the supermarket, you don't necessarily know what you're going to buy, but they tell you the price of everything.
Perfect.
So when you go to a hospital, including an emergency room, because people always want to talk about emergency services being so unpredictable, it doesn't matter. There's a billing office, there's a computer system. They take what was done and they turn that into a bill. Mm-hmm. That means the prices are known.
Yes.
So the idea that we can't know the prices in advance of all of the services is kind of ridiculous. And healthcare is no different than in any other industry in that regard. And what's often used as the excuse is, well, we don't know what the diagnosis is going to be. We don't know what services you're going to... That's not what we're asking for. What we want to know is what the prices are of all of your services.
Right. Yeah, like with the grocery store example, you have an idea what a box of cereal is going to cost.
Well, yeah, so let me tell you some of the things people say about why we can't have that. They'll say, well, you know, Dave, in a hospital, the price list could have thousands of things on it, 15,000, 20,000 things. That's crazy. We can't give all of that information to a patient. But you know what? Your typical supermarket has 50,000 unique barcoded items, 50,000 different things that are priced. Does that overwhelm you? No. As long as you can find the price on the one that you want to pick off the shelf, that's fine. Then they'll say to you, well, but healthcare is more complicated. People don't understand a lot of what's on the healthcare price list. When my wife sends me to the supermarket for cheese and she says, get some brie, get some Havarti, and get some good old-fashioned smoked cheddar cheese, there's 80 cheeses in the cheese aisle at Whole Foods. I don't know what 75 of them are. That doesn't bother me. It doesn't confuse me as long as I can find what I'm looking for and I can find the price.
Right.
Healthcare is no different. There is absolutely no reason that we cannot have the price of everything that might be done to us, of everything that we might buy. And the idea that healthcare is different than any other marketplaces is kind of crazy to Andrew and me.
Yeah.
So instead of just sitting around complaining about it, we thought we'd do something about it.
I appreciate that about you.
And so what we've done is we've created a ballot initiative that we are intending to put on the 2018 ballot. Here, ideally, we could do this in a legislative process with the Colorado legislature.
And we're trying to.
And we are trying to do that right now. I was just informed we are known as Proposition 85
for the ballot.
For our ballot initiative coming up here. So that will be fun to do. But within the bill, we've gone ahead and created a bill, and it kind of hits a couple different things. It hits this published pricing, this transparency in pricing, gets better alignment with the industry norms. David just mentioned a moment ago there are so many SKUs. Well, in medical terms, they're called relative value units and CPT codes.
Okay.
So a CPT code is common procedural terminology. Common procedural terminology. Sorry for not spitting that one out well. But what it does is it's a list produced by Medicare every year that says this is what Medicare will pay for the following services. And then it's all listed out. Every hospital, every medical provider, anybody in this business that is in charge of creating revenue out of healthcare services uses that exact same database. And we'll make the assumption it comes in an Excel format, Microsoft Excel format, or a tab delimited format, any way that you want it. But we'll make the assumption that every single finance professional that sees that number in a healthcare industry simply takes column A, multiplies it by about whatever percentage they wanted to, and they came up with their price of service. That's what we'd like to see. How did you do that?
And what Andrew's really saying is, it's as simple as saying, my prices are 150% of the Medicare schedule.
Exactly.
My prices are 1,000% of the Medicare schedule. That's it. This is not a complicated thing. The healthcare industry has convinced legislators, they have convinced the public that these things are complicated, that these things would hurt competition, and it quite honestly, I don't know any other word to use other than it's all a bunch of lies. And the fact that
no other industry
works this way.
Possibly.
That's right. Now there are so here's where the real smoke and mirrors comes into play. in any other industry, you always have a one-to-one relationship between a buyer and a seller. If you go to Walmart, it's you and Walmart, and they tell you what the prices are. But Walmart is also a customer, right? Walmart has suppliers. They have suppliers in China. They have to buy equipment to manage their stores and their headquarters and their distribution centers. They have to buy trucks. So Walmart's also a customer. And with its suppliers, there can be transparent pricing. There might be a system of bidding. There might be a system of negotiation. All of those things, whether it's transparency, price negotiation, and I know this is a business audience, so I know everybody understands this, those are all systems of what we call price discovery. You discover the price somehow at an auction. You bid. So you know the maximum you're going to pay is what you bid. You discover the price before the transaction.
Right.
Healthcare is the only marketplace where you have to wait until after the transaction to find out what the price would be. And this is why people have this feeling of helplessness. Well, what the industry would like us to believe is that we have to have some of those systems of negotiation, in particular between providers and health insurance carriers. But that doesn't work because we actually tell the patient that they are responsible. I can't tell you how often these days I've got an insurance plan. It's a $3,500 deductible for an individual and $7,000 for the family. And I'll get a bill from a hospital, and it will say, well, this is what your insurance company says is your portion.
It's called an EOB, explanation of benefits.
Right. So my child goes to the emergency room. The bill comes. It's $2,000. I haven't hit my deductible yet. They say, according to your insurance company, you owe $2,000. I say, well, wait a minute. My insurance company's not paying this. This is between me and you. This is between me and the hospital. I would like to see your price list. They tell me I'm not entitled to see that. And they tell me that the negotiation between them and my insurance company is secret. The word they prefer to use is confidential or proprietary. So we've got this complicated system where they've negotiated something, an agreement. In theory, that insurance company is acting on my best behalf. It's not actually true anymore. And I am responsible for those prices. That's a crazy system. That doesn't work. And so Andrew and I did analysis of this. We worked with a team of 15 people that include hospital executives, insurance industry executives, billing experts, doctors. And we concluded that the only way that you can create a rational, normal system here, because of all these interconnected relationships, is transparency. You can't have secret pricing on one side of what we call the healthcare triangle, and transparent pricing on another side. The healthcare triangle is the payer, the provider, and the patient. Right? So between the payer and the provider, you have a business-to-business relationship. They can do things however they want, except that they're subjecting the patient to it. Between the provider and the patient, I guess you sort of have a business-to-consumer relationship. And between the payer and the patient, well, what do? Most of the time we stick an employer in there and we create something that doesn't even lend itself to any kind of explanation or description. So you've got all these dependent relationships. It's super complicated, and the patient is left absolutely helpless, and they're left with the bill.
Yeah, it's sort of like the old GM line of we're a benefits company that makes cars. I'm a benefits company that provides medical billing services at this stage of the game, when you consider the amount of money that we spend here. So as we tackled this, we really said, how do we, and there's another bill that was out last year, Senate Bill 1765, 65, that created this top 15 in prices. Doesn't do anything. Nothing really gets accomplished by that. Yes, there's transparency in those first 15 codes. I personally created about 150 of those documents for various offices around the state of Colorado. It's a nice, interesting piece of information, but it doesn't get anywhere. So when we sat down, we said, if we're going to get involved in the political process, and I'm not a political person, I'm politically aware, I'm politically active, but I would never not consider myself a political person. But if we're going to do something, let's do something that makes a difference.
Yeah.
That if we're going to write a bill, let's write a bill that like would cause somebody to take a different action.
Yes.
In the way that we intend.
That it has to change something.
And so that's what led us to the bill. Dave, you want to kind of describe a little bit about the bill?
Well, not just that, but before that, when we talk about something changing, right? There's this belief that price transparency is very much about the patient's ability to shop around for services, right? We're going to change the behavior of people. Well, the truth of the matter is, we don't need to change the behavior of people. What we really need to do is change the behavior of the marketplace. So let's go back to the example of the supermarket. In the supermarket, you can look at all of the prices if you want to. You can shop around. You know when you go to Whole Foods, it's going to cost a little bit more than when you go to Safeway, which is going to cost a little bit more than Walmart.
Right.
But if you're in a hurry today, you're on your way home, you don't have anything to make for dinner, you just stop at the supermarket, you dash in, you grab some things off the shelves, and you don't even look at the prices. And that's because you don't have to, because you trust the system. You trust that if the prices at that Safeway were way out of whack, then they'd be out of business.
Right.
Then the media would call them out. Then some consumer website would reveal the differences. Because when we have transparency, we have all of this information. And so the theory that Andrew and I are operating under is that the more information you have, the less you need. Because the more information that we have, the more integrity there is in the system.
Right.
You can trust the system. So that's what we're really trying to do, is we're trying to transform the healthcare marketplace. We're not just trying to provide patients with the ability to shop around. So Andrew, we were going to talk about the different components of what's in this bill.
Right.
It's actually pretty easy for the providers. All we're asking them to do is publish their fee schedule, or in the case of hospitals, it's called a charge master.
Every private doc already publishes their fee
And they
schedule.
do. And we want to know, and tell us what your billing policies and procedures are. In other words, if you offer a 50% discount for a a self-paying patient, then just tell us that. Right? Don't send us a bill and make us call up and say, hey, listen, I'm uninsured. I'm paying for this myself. Do you have something for me? If your billing policy is that you provide a 50% discount to self-paying patients, then you need to disclose that to us on the front end. If you provide me with a 10% discount to pay you within 30 days, then you need to tell me that beforehand. Not send me a bill and slip in a little fine print that says you can call our billing office, you can ask for financial counseling, and when you do, then we'll talk to you about payment plans, we'll talk to you about discounts and those types of things. So it's actually pretty easy for the providers. For the insurance industry, that's where there's some pretty dramatic change. Right now, the real pricing for the 48% or so of the population, Andrew was talking to, about 52% on government insurance. The other 48% is either covered by employer-based insurance, self-insurance, and there's still a small percentage of people in there that are uninsured as well.
Less than 6% in Colorado.
Less than 6%. So where does the pricing actually come from? It doesn't actually come from the providers. The pricing actually comes from the insurance carrier who has negotiated something with the provider. So the only way you get to transparency is if the insurance companies tell their members what the prices are going to be. Now, they will tell you that they'll do that. They don't. You go to your insurance carrier's website and you try to look it up, and again, you'll find some prices here or there. You need to already know what your diagnosis is. You could never print out a list that says, here's all the prices I would pay for this doctor. Here's all the prices I would pay at this insurance, at this hospital. And so you can never get to an actual price list. You can never put two price lists side by side. You could put two procedures side by side, but as Andrew already told us,
Yes.
those providers are, in reality, are saying, you know what, I'm always 180% of Medicare, or when another one says, I'm always 160% of Medicare. Well, you can't figure that out unless you actually have all of the prices to compare,
Yes.
or they tell us, I charge 180% of Medicare. But if you go to the supermarket, you know what? You can fill your basket with groceries. You can go to another this is what consumer websites do.
Right.
They fill two identical baskets, and they say, you know what? Whole Foods costs 30% more than Walmart. I just looked that up the other day.
Yeah.
For exactly the same product, you would pay 30% more. Why can't we do that in healthcare? The only way we get there is with complete transparency on the prices that have been negotiated from our insurance carriers.
Hindsight's 20/20, right?
Yes.
When I get my medical bill, when I get my explanation of benefits, it's crystal clear on what I owe. It's crystal clear how they came to that amount. Maybe crystal clear is the wrong word. It's written down
It's written
somewhere
down. It's plain.
that says that I owe
Yeah.
$100 for this and $1,000 for this and $20 for that, right? Why isn't it that clear before?
Exactly. Yeah, it's not derived from some.
They knew before.
Yeah, they just didn't want to tell you.
The restaurant that I walk into that doesn't have the prices on the menu, they knew what they were going to charge me. Why can't you tell me that?
Right. And, you know, healthcare is a marketplace where we deserve to know that. Look, if you want to run some super high-end restaurant and that's the way you do business because you attract the wealthiest of the wealthy, that's fine.
Fine. Yeah.
Healthcare is fast approaching 20% of our GDP, which means it is the biggest single expenditure for families these days after their mortgage. And the idea that we have to buy health care and feel like we're buying sleazy used cars, that's a problem.
Yeah.
Well, and now I'll take my individual hat off. I'll take my consumer hat off. I'll take my business owner hat off.
Okay.
And I'll put my taxpayer hat on.
Right.
52% of the U.S. population is on some form of government health care. How to come up with that number? 23% are on Medicare.
Okay.
23% Medicare. 17% nationally on Medicaid. In Colorado, it's actually 21%. The federal government workforce, 16.7 million people in the federal government workforce. The Veterans Administration, and thank goodness they get great care.
Yes.
Government contractors,
Okay.
getting paid through those vehicles, those venues. The Indian Health Service. Right? There's a large cache of people that are receiving federal health benefit. At which point, you and I, as taxpayers, are footing the bill for all of that 52% of that audience. And if they don't care what it costs, because it's just provided as a government benefit to them, then theoretically my tax burden, my country's debt burden,
Exactly.
goes up.
Well, you know,
Who's got control of that?
Well, and one of the things we hear all the time is the healthcare providers, and I'm mostly talking hospitals when I say that, and those physicians that kind of hide behind the hospitals, the ER physicians, the anesthesiologists. They like to tell us that they're getting underpaid by the government, and therefore they overcharge us because that's how they compensate for it. Well, I've got two things to say to that. Number one is, assume that's true.
Okay.
You still need to tell me what the price is. Tell me how much I'm subsidizing them by. When I go to
And
Walmart,
that doesn't make it right either.
when I go to Walmart, Walmart has to cover the fact that they lose about 1% of their product to theft, right? And so my prices are 1% higher. That's built into the price. So that's just fine. So you know what? I don't care. You still need to tell me the prices. The second thing is that in this country we are paying close to double what any other developed country pays for health care, where they actually get better outcomes. Medicare, on average, pays about 15% less than private sector insurance companies, right? Sometimes it's
it changes, but
it
generally
could vary.
it goes back. They all start from the same fee schedule, and Medicare is the base fee schedule.
Right.
Okay.
So if we're paying 50% too much in this country, and Medicare is only underpaying by 15%, then even Medicare is overpaying at the end of the day. They're just overpaying by less. So this idea that we are subsidizing Medicare and Medicaid through private insurance and we're hiding that from the people, that's just another one of those nonsensical explanations for why we can't have the information that we're entitled to. The truth is, when we get to a more competitive and more efficient system, that's going to drive down costs for Medicare and Medicaid too. So as taxpayers, we're entitled to transparency. If you're on Social Security, we still need transparency. If we went to a single payer system, the government still needs to know what it's paying for. And you know what? Single payer doesn't mean single provider. So when the Department of Defense is looked at, you clearly see it's a single payer system, right? But it's not a single provider system. The government will still have multiple companies bid to build fighter planes and to build tanks and to buy guns and bullets. And so the government needs a competitive marketplace too. So this idea that capitalism is bad and that it's capitalist greed that has driven up prices in healthcare, that's not it at all. It is actually a lack of competition because it's a dysfunctional system without transparency.
And to pick that up, when we say price transparency, we don't mean lower your prices.
Right.
You could charge, in fact, many of our docs, I'll use a dermatologist, I'll pick on dermatologists for a second. A lot of dermatologists are very proud of the art that they create when they remove the lesion from your face and sewed your face back together, and to the point that you can't even notice that there's a scar there. That's an artist doing a service.
So you're paying a premium for not having a scar. And
many of the guys that we work with that happen to be a dermatologist or an orthopedist or at some level, they're very proud of the work that they do, and they'd like to be able to charge a premium because they're that good.
And for their experience.
So they're actually being held back by the market of what their true potential can be.
Because when we don't have a truly competitive market, when we don't have price discovery, when we don't have price transparency, patients aren't making decisions about, you know what, I'd like to go to this doctor over that one because I think that they're better. Right? And so Competition is necessary to weed out weak performers.
Yes.
It's necessary to allow stronger performers to thrive. It's absolutely necessary to drive innovation. This idea that if we reveal prices, that's going to hurt competition. Well, you know what? Walmart and Target are across the street from each other. Burger King and McDonald's are across the street from each other. Last I checked, these companies all fiercely compete, and they all print money. Okay, so what the evidence shows is that competition drives costs down and profits up. They're afraid, because they've never really had to compete in many cases, they're afraid that revealing prices is going to actually drive profits down. Only uneconomic profits, only unfair profits, only
Right.
profits that are going to weak performers that should have been weeded out of the market, either by going out of business or through consolidation, acquisition, that type of thing. But right now, we don't have a functioning marketplace that's doing any of those things. We have too many specialists in some cases, not enough primary care physicians, right, focusing on prevention, because we don't have price signals that create balances in supply and demand. Again, I keep saying it's just a dysfunctional marketplace. It doesn't work like any other market because it doesn't work at all.
What's happened in Colorado, and I'll say since 2008, is the entrepreneurial marketplace for physicians, meaning doctors who are going to hang up their own shingle and be a private business, has gone down from 39% of the market to 19% of the
Really?
market, while hospitals have increased during that time. From 2012 to 2015, Medicare spending nationally went up 49%. Why? So we've got a decline in small private businesses. We've got an increase in Medicare billing, and it's because hospitals are buying up these private practices, then billing Medicare increased costs and passing that directly back to you, the consumer, as their cost. Because
That is one of the most obscene things that happens, Andrew. A doctor that was in private practice last year gets bought by a hospital, like Andrew says. They're still operating out of the same building. They haven't moved their offices to the hospital.
Same carpet.
But they now legally fall under the licensing and the business practice. And so you know what? So if that doctor was charging $80 for a visit last year, now they're charging $80 plus, I don't know what
Plus
the
a
numbers are,
facility fee
plus a
that's
facility
roughly
fee,
$50
another
per visit.
And what the hospitals will say is, oh, well, that's because we buy the equipment now for them. We pay their rent for them. Well, who was buying the equipment and paying the rent
before?
The small business owner.
Right. And they were paying that out of that $80, and they were still making money, and they were happy owning their own business. But now they get gobbled up, and and so that has driven Medicare's costs, and for the rest of us, that has driven costs up tremendously.
So we're talking about this transparency in healthcare, and Andrew Graham and David Silverstein are working on brokenhealthcare.org, putting a ballot initiative together. Can you tell us how can anybody listening get involved and help move this forward?
Well, number one, go to brokenhealthcare.org, and there you will find places to donate money, to volunteer. Right now, we are asking for all kinds of volunteers. Look, this is something that affects every individual and every business in Colorado. You think about it this way. If you can just imagine if you could restrain next year, this year, healthcare costs, insurance costs went up an average of 5.5%. That's about twice the rate of inflation. Okay?
No.
So imagine that we are able to restrain that to only going up at the rate of inflation, or 1% over the rate of inflation. Right there, we're talking about saving millions, tens of millions, really across Colorado, hundreds of millions of dollars. And so we need businesses to get involved and help us. We want to come into your business to collect signatures, right? We're going to collect 150,000 signatures for this ballot. You can sign up to have us come into your company to collect those signatures, which is a lot more efficient for us than going door to door or standing out on the 16th Street Mall. We'll do all of those things as well. We are going to have to raise a lot of money, but think of this as an investment. This is not a charitable donation to a good cause. This is an investment. If you're running a good-sized business, you're paying thousands, tens of thousands, and hundreds of thousands, many businesses here in Colorado, millions of dollars a year for healthcare. So I've got a friend who runs a business. His healthcare costs run about $10 million a year. So if we can restrain the increase in cost by just 1%, that's going to save him $100,000 a year. You better believe he's happy to donate $25,000 to this cause.
Thank you so much, David Silverstein and Andrew Graham, for giving us this background on the transparency in healthcare and what we might actually be able to do. And that's coming up, what was it, Proposition 85?
Proposition 85 hopefully be on your ballot later this year. At bare minimum, we'd like to get something through the legislature this year as well.
Thank you so much.